Welcome back, dear students. Hope you might have enjoyed my first lecture, which was basics of psychopharmacological psychotherapy or therapy. I discussed the pharmacodynamics and pharmacokinetics, the meaning of these terms, and ended with this slide where I discussed that all the psychotropic drugs that are used for treatment of various types of mental disorders are broadly classified into six classes: antipsychotic or neuroleptics, anxiolytic, hypnotics, antidepressant, mood stabilizer or anti-manic, and finally psychostimulants. Today I will discuss the neuroleptics. Before I go to the next slide and start discussing neuroleptics, I would like to say that we are psychology student and we have to be aware, as I discussed in my first lecture, the basic indications of these medicines. Means indications means for what disease or what conditions these medicines are used, what are its side effects, how they act, the mode of actions. So largely my lecture will focus on the classification of the various medicines into a particular category. Say for example neuroleptics, there may be different types of neuroleptics, so the various classes of neuroleptics or anxiolytics or hypnotics. I will start with this, so I am sharing this general frame so that next time when I will discuss say anxiolytic, today I am going to discuss neuroleptics only. So first I will discuss the classifications, then the mode of action, how they act, which neurotransmitter is influenced by these medicines, how they create the therapeutic impact, that is mode of action, where they actually act, and then what are the indications for what conditions they are used, and then finally the side effects and any other cautions, precautions that may be needed for their prescriptions. So this will be the general framework of discussing all the six classes of psychotropic drugs used for treating mental disorders. One thing more, that though in terms of indication I will name some disease, say schizophrenia, obsessive compulsive disorders or other DSM-5 classifications or DSM-4 classification or ICD-10 classifications. But remember that there are several mental disorders and the number of mental disorders are more than these six classes of medicines. So do you wonder that how, if diseases are more than six and we are having only six classes, how it will be used? So though I will discuss or I will say that this particular class is used for this disorder, this disorder, this disorder, but remember that these classes basically act on some basic core symptoms. For example, neuroleptics, they largely act on such symptoms like hallucinations, delusions, agitation, aggression. Similarly, antidepressants or say psychostimulants, they act on some cognitive aspects of the functioning. And if these symptoms are involved in any disease condition, then you can prescribe. So a combination treatment is generally followed. So for some symptoms, you will prescribe neuroleptics. For other symptoms, you may prescribe antidepressant. For example, say one person who is having mania, bipolar disorder. Generally, the mood stabilizer, say valproate, is prescribed or lithium is prescribed. This is the only medicine. But generally, if that manic patient is having also very aggressive temper, agitation is there, then some neuroleptics or antipsychotics are also prescribed. And the most commonly prescribed neuroleptics nowadays is risperidone. Earlier, it was to be the classical neuroleptics haloperidol. So, And the combination of risperidone and mood stabilizer valproate has been found to be more successful in treating bipolar disorders. And it has been noted that if 24 months treatment is done using the combination of, say, risperidone and valproate, the relapse rate is very low. So remember that for teaching purpose, I will list various names of disorders that this drug is used for, this type of mental disorders. But these psychotropic drugs basically target some symptoms, and those symptoms may be the core feature of that disorder, and therefore they are working for that disorder. So with these two basic notes, that what is my teaching frame for it, and that any particular class of medicine is not only for that a particular disorder, but it is for a particular class of symptoms. So let us proceed to what is neuroleptics. Neuroleptics are, the slide is not progressing. Let me check what happened with this. It is not moving. Ah, some problem was there. Sorry. So, oh, it has moved more. So it was the system problem. So I was here, now I am coming to the neuroleptics. Sorry for this disruption. So neuroleptics were developed during 1950s, and during that time, thorazine, a particular chemical, a substance, and remember that we are social science people, we are not scientists, and we are not much. So don't be scared by these tongue twister names that you will face in this class. So thorazine was initially invented in 1950s, and this was developed in the context of anesthesia. So this thorazine was used for anesthetizing patients during surgery. But later in 1950s it was found that this medicine may have anti-psychotic effects also. So thorazine was one class of initial drugs. Similarly, there is one drug uh, that is also used in Indian context. It is called sarpagandha, and the extract of sarpagandha is raspirine. Probably I am forgetting the name. So that was also used in initial days for treating neuroleptics, but later it was discontinued because of its depressant effect. Those people who were taking the extract of sarpagandha, I am not remembering the exact name. In the next class, I will try to share it with you. But it is raspirine or something like that. So this was the beginning of treatment of psychotic conditions. And newer class of neuroleptics or antipsychotics were introduced in 1950s. So I will come to that. So neuroleptics can be classified into several classes. One classification that I am showing you here is given by Kulari. Yeah, there is a book by Kulari on clinical psychology, and there is one chapter on psychopharmacological therapy. That will be very helpful. If you get access to that, that will be very helpful, because it is a brief chapter and summarizes many things about the psychopharmacological therapy. And if you want detail, you can go to synopsis of psychiatry, more detail. Then there are books specifically devoted for psychopharmacological therapy, but I would not recommend for you. Those books are basically for the practitioners who are basically trained in psychiatry. So neuroleptics can be classified into several types. Here you can see that Kulari has classified the neuroleptics in 6 types, phenothiazines, and in bracket I have written thorazine, chlorpromazine. These are in phenothiazine class. These are the particular salts that are used: thioxanthines, dibenzoxazepine, and you can read the names. So I am not reading all these names. So these were the sixth class, but for we psychology students it will be very difficult to remember, and this is one classification. Many other classifications are also there. So for simplicity, I have classified and I generally classified the antipsychotics or neuroleptics into two classes. The conventional neuroleptics, those neuroleptics which begin in the 1950s and continued for a long time before 1990s. And this include such medicines as phenothiazines, thorazine or chlorpromazine is the medicine under this category. Butyrophenos, Haldol, and Haldol is the trade name. For example, crocin is the trade name and paracetamol is the salt. So either Haldol is like crocin and haloperidol is like paracetamol. So haloperidol, piperazines, I have written the name, flufenazine is the salt. This type of conventional neuroleptics. So the various neuroleptics can be classified either as conventional or atypical or newer neuroleptics that were invented in 1990s and later on. And this includes such classes of medicines as dibenzodiazepines. So clozapine is the salt and clozanil is one brand name. Benzoxazole is one category, one class, and risperidone is one particular salt in this class. I mentioned this salt earlier that when you are treating bipolar disorder, risperidone can be prescribed with valproate. So let us complete that. Neuroleptics can be broadly classified into two categories: conventional neuroleptics and atypical or newer neuroleptics. The newer classes of neuroleptics, they are having some advantages. How they differ from the conventional one? First thing is that the newer neuroleptics or antipsychotics, they have fewer side effects as compared to the conventional neuroleptics. The second difference is in terms of mode of actions. The conventional neuroleptics, they generally effect on dopamine receptors. The dopamine is a neurotransmitter, and particular there are different receptors. It basically works on D2 receptors. On the other hand, the atypical neuroleptics, they generally produce their therapeutic effects by blocking 5-HT2, that is also called serotonin. So they work on serotonin receptors. So in terms of mode of action, what is the difference between newer and the conventional? Newer are working on serotonin receptors and conventional on dopamine receptors. Similarly, in terms of side effects, conventional have more side effects and newer has fewer side effects. But remember, despite the fewer side effects, still conventional neuroleptics are prescribed as first line treatment for psychotic condition, and the newer neuroleptics are reserved for treatment resistant schizophrenia or other conditions. But it does not mean that it is not prescribed. It is also prescribed. Such medicines means this newer class of medicines are also more effective in treatment of negative symptom schizophrenia. The schizophrenia, you all know, can be classified as negative symptom and positive symptom. What is the meaning of negative symptom or positive symptom? If any symptom which is being seen in schizophrenic, but those symptoms are not in the general repertory of the behavior of a human being, then that will be one addition. Therefore, it is called positive symptoms. But if some of the symptoms which are present in the daily repertory of the human behavior, but they are now absent, so absence is negative symptom. So such negative symptoms includes cognitive impairment. So The good cognition is one thing that should be present in a general normal human being. If it is impaired, it is absent, then it is a negative. Speech impairment, anhedonia. We all have hedonia means the pleasure. We all have the hedonic capacity to be happy and to be joyous. But if this capacity is absent, means something from the general behavior is absent, then it is negative symptom. For such negative conditions of schizophrenia, the neuroleptics of the newer classes are more beneficial. And example of positive symptoms include hallucination. Hallucination is not the normal behavior. We do not see anything if nothing is present in the real environment. But many patients, they see, hear something in the environment which are basically not present. So hallucination is addition of behavior. Therefore, if any schizophrenic is hallucinating, he will be classified as positive symptom schizophrenic. This is basically the psychopathology thing, but I am discussing here because I mentioned this term. So it is clear these are the major differences between the newer class and the conventional. In terms of mode of actions, I have already discussed, but let us see again. The mode of action of neuroleptic occurs mainly through blocking of dopamine receptors. They block the dopamine receptors activity. And there are several kinds of dopamine receptors D1, D2, D3, D4, D5. But most of the neuroleptics specifically work on D2 receptors. They block the D2 receptors, and by blocking these D2 receptors, the therapeutic effect is observed. And on the other hand, the newer medicines where they act on serotonin receptors 5-HT2. So this is the difference between mode of action also. So we have covered the classification of medicine as I said in the beginning of the class. Now we have discussed the mode of action. Then what will be the next? Just try to think. Indications. Indications means for what condition, for what disease these medicines are used. The most common indication of neuroleptic is the symptoms of hallucinations, delusion, and agitation. As I discussed in the beginning, that these medicines basically target some symptoms. So, any condition which involves hallucination, delusion, or agitation, even if it is not psychotic and it is associated with very severe aggression, you can prescribe neuroleptics. So the primary indications, though they focus on hallucination, delusion, and agitation, the primary indication is acute and chronic psychosis. But this can also be used as prophylactic treatment for schizophrenia. And prophylactic treatment means those treatments, prophylactic medicine means that medicine which reduces the chance of recurrence of the disease. Suppose these days in corona pandemic we are taking too many things for boost our immune systems. So this may be a prophylactic type of thing. It will prevent the occurrence of the disease. So any medicine that prevents occurrence or reoccurrence. So sometimes these neuroleptics are used. The patient is symptom free, but even then the medicine is continued. Why? As a prophylactic treatment. Other indications include, as I said earlier, bipolar disorder. If bipolar disorder is associated with hallucination, it is not generally, but bipolar disorders are generally associated with delusions, delusion of grandiosity, delusion of sin and guilt if they are in the depressive phase. So if it is associated with delusion, then we can give these neuroleptics in bipolar disorders also. Similarly, it is commonly prescribed medicine for Tourette's syndrome. This syndrome is basically characterized by, tics, involuntary rapid sudden movements. And this may involve simple tics. Simple tics generally involve very small group of muscles, and complex tics, they involve a coordinated movement of different muscle groups. So simple text, for example, may be eye blinking, shoulder shrugging, like this type of involuntary movements. And this may be, the tricks may be motor tricks, or even they may be vocal tricks. So some vocalizations may occur like grunting, like other vocalizations. So I am not going in detail. You can go and through your psychopathology book and you will find what is Tourette syndrome. But here the focus is that Tourette syndrome can be treated using this neuroleptics. Similarly, if there is organic aggressive syndrome is that aggression which is associated with some brain related dysfunction because of tumor in the brain, because of head injury, or because of head trauma. Sometimes people develop aggressive behavior. Even then you can use. So organic aggressive syndrome itself is not psychotic condition, but since it is focusing on agitation and aggression, the neuroleptics can be given. Remember, again, I am repeating it again, that these medicines, all these six classes, they target the symptoms. But if any disease includes those symptoms, that medicine can be used. How long does it take? So, for relief of symptom, and we should know as a psychologist, because many of the clients will be coming and they will say that they started, but they tried for 1 week or 2 week and then they stop medicine. Then we will psychoeducate. No, you are on neuroleptics and it will take 3 to 4 months, 3 to 4 weeks to take to show its effect. So generally, symptom relief occur after 3 to 4 weeks of administration. For treatment of schizophrenia, generally the conventional neuroleptics are the first line treatment, despite its several side effects. But for treatment resistant schizophrenia, you can go to the newer class. Neuroleptics, as I said earlier, are also used in treating bipolar disorder patients for addressing their psychotic symptoms. Not, remember, they will not treat the bipolar condition, they will treat the associated psychotic symptoms like high agitation, delusions of grandiosity, like that. Similarly, for Tourette, and the general medicine that are prescribed is haloperidol and risperidone for bipolar disorders. For Tourette syndrome, the commonly used neuroleptics include pumoside, haloperidol. But these are just examples. Nowadays, a lot of new medicines have come and they are being prescribed. Just I am giving some examples. And final indication is that neuroleptics are sometimes also used for obsessive compulsive disorder. But remember, when it is associated with Tourette syndromes or schizotypal personality. So these are the uses. So indications means the uses of the medicines, where we can use the medication. So I have covered the classification of neuroleptics, their mode of actions, their indications. Now the side effects. It should be there. But before going to side effects, I would discuss some alternative treatments that have been experimentally used by psychiatrists to treat schizophrenia. So there are several class of medicines, but remember they have not been approved by the FDA. Generally, these alternative medicines includes benzodiazepines, mood stabilizers, beta blockers, calcium channel blockers, and generally they are used as supplementary medicines. They are not generally the sole medicines for treating the psychosis or the schizophrenia. So depending on the symptoms, these medicines are also used in treating psychotic conditions. So I think things are clear. This is uh, a remote class, and unfortunately, I have not having the opportunity to interact with you. Therefore, I cannot take up questions. If there are any questions, please ask questions in the WhatsApp group. Now, coming to the side effects of neuroleptics, there are a range of side effects. Side effects of neuroleptics may include almost all organ systems. For example, disturbance in temperature regulation. Some medicines may create the effect of hyperthermia, high fever. It is those I will tell you one particular side effect that is called neuromalignant syndrome. It is characterized by high fever. So the disturbance in temperature regulation may be one side effect. Similarly, hypersensitivity may occur in some patients. Uh, I am listing all possible side effects. It does not mean that all side effects will occur in all individuals who are on antipsychotics. So hypersensitivity may be hyper photosensitivity, it may be in terms of rashes. Ocular changes, for example, blurred vision is very common symptom of neuroleptics. Endocrinal effects, many hormonal changes, for example, pancreatic function may be influenced by neuroleptics and it enhances the development of diabetes also. Similarly, uh, the prolactin secretion is also influenced by this neuroleptics and they induce prolactinemia, and many male patients they develop some sexual problems also because of this imbalance. I will come to that again. Gastrointestinal effect are there. Constipation is one very common gastrointestinal effect. Similarly, it may have CNS effects, and many CNS effects I will cover in the next slide in detail. Similarly, they may have various cognitive or neurological effects also. And I am going to cover the EPS, that is basically a neurological effect. Sexual dysfunction, as I said, that the sexual dysfunction is generally influenced because of the hormonal changes induced by these medicines. And this antipsychotics can also influence our cardiovascular systems, and therefore a number of cardiovascular effects will be there. And these are broader categories of the side effects. Under cardiovascular side effects, there can be several side effects. So we will not go in that detail because we are not a prescription agent. We are not going to prescribe. We are required to know or develop the awareness of these things. But there are two important classes of side effects of neuroleptics that must be discussed in detail, and therefore I will discuss in a little detail. The most commonly occurring symptom is called EPS, extrapyramidal syndrome. This is a very common and remember a very severe side effect. So, EPS or extrapyramidal symptom is basically a neurological side effect of antipsychotic medications. And generally, they occur in the first few days or weeks of the treatment. But in some cases, it may appear even after months or years of antipsychotic medications. And generally, they are associated with the use of conventional neuroleptics. EPS is more common among patients taking conventional antipsychotics, one thing that I said, and more than 60% of the people who take conventional antipsychotics, they experience EPS. So EPS is more common with the conventional neuroleptics and not with the newer neuroleptics. Extrapyramidal symptoms or syndrome, they include a variety of symptoms. So this is not one. The one category of EPS, and for your ease, I am using the technical term in parenthesis, and I have tried to use simple words so that you can remember. So tardive dyskinesia is one EPS, and this basically is characterized by involuntary movements. So this involuntary movement will help you to remember what is the meaning of tardive dyskinesia in brief. And I have used this type of convention for all the symptoms, side effects that I am going to cover. So tardive dyskinesia is one of the most common EPS, and this is generally associated with involuntary movements, and the most affected organs are mouth, lips, and tongue. So it may be appearing in terms of facial tics, means involuntary movements of different facial parts, rolling the tongue, licks the lip, होंठ को काटना मोड़ के, इस तरह के बहुत से symptoms हो सकते हैं. Sometimes this is the facial, the neck area is more involved, but sometimes the tardive dyskinesia may also involve the trunk or other parts of the body. It occurs after long-term treatment with neuroleptics, remember. So it is not seen in the fewer first week, second week like that. It occurs generally after the long-term use, or it may occur even when you start lowering the dose or you stop the neuroleptics. And as far as its prevalence is concerned, TD is generally observed in 25% of the cases. Generally, this side effect is managed or minimized by reducing the medication or dose, or by changing the type of medication. So if X medication is creating this, we gradually lower the dose and then shift the medicine from X to Y, and probably this may reduce this. Otherwise, if it is there, some other medications are used. Remember that they are very difficult, very severe side effects, so they must be managed somehow medically. The second is tremors and rigidity, but the technical term is pseudo Parkinsonism syndrome. And in simple terms, it is defined by tremors, तो कपाहट और rigidity, कठोरता, इन दोनों से प्रभावित होता है. So some patients may develop symptoms resembling pseudo means false Parkinson. So they will show the symptoms like Parkinson's, तो हाथ पैर उनका कांपता रहेगा, हिलता रहेगा, but this is not the real Parkinson. This is occurring because of the effect of the neuroleptics, and generally it involves such symptoms like tremors, rigidity, even it may include temporary paralysis, or sometimes very extreme slow movement like slow movie you are seeing. If people are moving like that, that may be one indication of pseudo-Parkinsonism syndrome. These pseudo-Parkinson syndrome or symptoms, they generally occur within the first few days or weeks of the administration, unlike the tardive dyskinesia, which occurs after long-term use or when we stop or lower the dose. Sometimes the symptoms of medication induced Parkinsonism may be confused with the negative symptoms caused by schizophrenia and disease itself. So, there the psychiatrist must be careful in differentiating this, whether it is pseudo-Parkinsonism or this. But sometimes this confusion occurs. Another EPS is akathisia. It is defined by body restlessness. If you are restless, you are not able to sit at one place, moving here and there. This may sometimes be because of the influence of the conventional neuroleptics. So, akathisia is a condition associated with the use of certain medications or medications of the neuroleptic class, and characterized by an internal sense of motor restlessness, and it is often described by the person as inability to resist the urge to move. So I am asking you to sit on the chair and you are not being able to sit. You are internally feeling that I have to remain seated there, but you don't find yourself able to sit. You are just standing up, then again sitting down, standing up again. So, this internal sense of motor restlessness is the more important part. So, and generally it will appear in the outer behavior, but internally you feel that you are not able to control your restlessness. And the most common restlessness or akathisia involves pacings, मतलब आगे पीछे चलना, जैसे मूवी में घबराहट या चिंता में लोग एक जगह से दूसरी जगह चलते हैं. So moving back and forth in the same room. So this type of pacing may be there, or inability to sit still. You cannot be able to sit at one place. You will be sitting, standing, moving there, here, again sitting. This type is very common. And this is very distressing for the patient. Why? Because internally the patient is feeling that he has not to do this type of motor activity. He has to control this restlessness, but he or she is not finding uh, or is not able to control it. Therefore, this creates a lot of distress. And this distress in turn sometimes reduce the ability to perform everyday tasks. This distress along with the restlessness. If you are restless, how you will be performing your day-to-day activity? There are other forms of EPS also. One is akinesia. You know, kinetic kinesia means the movement, the dynamicity, and A means absence. So akinesia is a condition in which the movements, the dynamicity is reduced. You are less dynamic. You are less doing less movements, and this again occur because of the prolonged use of neuroleptics. Similarly, muscle contractions, it is also technically called acute dystonia. This may occur in some patients, and this is very painful. Acute dystonia is generally a spastic contraction of the muscle groups, and it may involve your neck, eyes, trunk, or any other body part. And it occurs when suddenly involuntary contraction of the muscle group occurs, you will feel pain. Therefore, this acute dystonia is a EPS which is very painful and needs to be managed carefully. How often this occurs? When it occurs, in most of the cases, it occurs within the first couple of days of treatment. And it can be effectively and rapidly treated with medication. So there are some medications to handle this condition. Now, APS I have covered. So those symptoms were APS. Apart from APS, there is a severe side effect which is abbreviated as NMS, Neuroleptic Malignant Syndrome. And in simple terms, if you want to remember it, then the core thing is change in breathe and heart rate. So NMS is largely characterized by change in breathing and heart rate, but it includes other symptoms also, you will see soon. So first thing we should know that this NMS, if it occurs after use of neuroleptic, may be fatal, may take the life of the patient if not treated timely. It includes rapid heartbeat, diffuse muscle rigidity, tremor, hyperthermia means high fever, labile blood pressure means blood pressure is sometimes increasing, sometimes decreasing, most often it is increasing, cognitive dysfunctions and autonomic disturbance. But the core is the change in breath and heart rate. This is one thing which may be fatal, and another is hyperthermia also, very high fever. This may also be not good for the patient. This condition can be sudden and often occurs early in the course of treatment. Remember. So this will generally, if it has to occur, it will occur within first week or at best second week. And fortunately, it is not much common in younger age patients. NMS is more common in cases of rapid neuroleptization in younger people and in case of over 60 years age. So if you are prescribing neuroleptics for 60 plus, then there is a chance of NMS. Or rapid neuroleptization means generally increasing the dose of the neuroleptics very rapidly. If you prescribe 20 mg of neuroleptics today, and then you said that after 2 days you increase it to 40 mg, and then finally you come to the fixed and final dose of 100 mg after next 2 days, this will be called rapid neuroleptization. So sometimes because of this, NMS may occur even in people younger than 60 years. And remember that this will not be treated just by discontinuing or changing the medicine. It requires supportive therapy. So if fever is there, hydrating, cold sponging, this will be needed. Correcting electrolyte imbalance will be needed. How you can cool the body, that will be required. But sometimes anticholinergic agents are used. So it is, I am not expert of that, but some medical intervention. We should know that if an MS occurs, it requires immediate attention and some medical intervention is needed depending on the signs and symptoms. It may include heart related changes, it may include only high fever, it may include both. It depends. Now, newer classes, they are having fewer side effects, but they are not free from side effects. Some of the severe side effects of newer classes are also there. So this is clozapine is the newer class, and agranulocytosis is one side effect which is characterized by WBC count, reduced WBC count. So newer neuroleptics, they are having fewer side effects, but they are not free. Similarly, in some conditions like with risperidone, an MS is very likely side effects. So an MS may occur with the conventional uh, neuroleptics also, but this may also occur with the newer neuroleptics. So these are the side effects, and thanks for today. In the next lecture, I will be interacting with you and I will discuss anxiolytics. See you soon. Thanks a lot.